Good afternoon, and welcome to Nutrition Basics. My name is Samantha Haswell, and I'm the Integrative Health Dietitian at Massey Comprehensive Cancer Center. Today, we'll be talking about ways to boost your bone health. Let's start by talking about bone density. Bone density is the amount of bone minerals in your bone. Having less of these bone minerals in your bone, or loss of bone density, causes the bones to thin and become full of tiny holes. This increases your risk of fractures. Loss of bone density, known as osteoporosis, is common as people age, particularly in postmenopausal women, due to low levels of estrogen. Estrogen naturally slows the breakdown of bone, therefore it's not uncommon for people to experience bone loss following menopause. Though we talked about how osteoporosis is more common in postmenopausal women, loss of bone density can occur in both men and women due to poor nutrition, low intakes of calcium and vitamin D, or bed confinement for long periods of time. Loss of bone density can also occur in cancer and its treatments. For example, some chemotherapies reduce calcium in the blood. Some radiation treatments may weaken the bones. Cancer in the bones themselves may result in loss of bone density. Steroid treatments can sometimes lead to bone loss. And hormone therapies, such as those who suppress testosterone in prostate cancer patients and estrogen in certain breast cancers, may increase risk of osteoporosis. Additionally, ovarian suppression may also increase the risk of bone loss due to reduced estrogen levels. Now that we've talked about osteoporosis, let's talk about how we can boost your bone health to help prevent it. Let's start with getting scanned. Talk with your doctor and see if a bone density scan is appropriate for you. This can determine if bone loss is present. To help maintain or increase your bone density, boost your weight-bearing exercises as safe and able. Exercises like walking, running, weightlifting, dancing, taking the stairs, and jumping rope are all weight-bearing exercises. To boost your nutrition for bone health, maintain a healthy weight. A balanced diet is crucial to maintaining healthy bones. People who are underweight are more likely to have bone loss and fractures. In addition to a healthy weight, certain vitamins and minerals can also help maintain bone health, including vitamin D, calcium, magnesium, and boron. Let's talk about each of these individual nutrients and how you can get more of these foods in your diet. Calcium is a major component of the bone, but also helps with heart, muscle, and nerve function. Calcium deficiency can lead to reduced bone strength and osteoporosis. When calcium is low in the blood, the body takes it from the bone, causing osteoporosis over time. It's important to get enough calcium through supplementation or food to meet your calcium needs. But keep in mind that hypercalcemia or high calcium in the blood can occur with some cancers, so supplementation or high intake of calcium-rich foods may not be recommended. Talk with your medical team before starting calcium supplements to make sure this is safe for you. But let's talk about calcium-rich foods for when your calcium levels are low. The most well-recognized calcium-rich food is dairy. All dairy products are high in calcium, and often dairy products like milk are fortified with vitamin D. Dairy products include items like milk, cheese, and yogurt. Other sources of calcium are non-dairy milks like soy milk, almond milk, and oat milk. Non-dairy milks are fortified with calcium to make up for the lack of calcium in these products naturally. Some orange juice has also been fortified to include calcium to help people reach their calcium needs. Other foods that are naturally high in calcium include canned salmon or sardines, with the soft bones included, as the bones themselves are calcium-rich. And other plant-based sources of calcium include white beans, soybeans, dark leafy greens, and broccoli. Let's talk a little bit about vitamin D. Vitamin D is also known as the sunshine vitamin and is essential for strong bones as it is required for the body to properly absorb calcium. Vitamin D is naturally created in the body through absorption of sun rays, particularly UVB rays, but certain factors may limit the amount of vitamin D you absorb through the sun. One of these factors is skin pigmentation. The darker your skin, the longer you need to spend in the sun to absorb enough UVB rays to generate vitamin D. Another factor is time of year. During the fall and winter months, we tend to bundle up more, which limits the amount of vitamin D we can get from UVB radiation because there's not as much skin exposed. Geographic location also affects your exposure to UVB rays. The further north or south of the equator you are, the less UVB rays reach that area, which also increases how long you would need to spend in the sun to get enough UV radiation to create sufficient amounts of vitamin D. But while we talked about all these factors that can affect vitamin D and UVB rays, let's talk about the risk. Unprotected exposure to UVA and UVB radiation from the sun can cause skin cancer over time. So ideally, we want to limit the amount of our exposure to the sun that occurs. But this may limit the amount of vitamin D your body creates from the UVB radiation. Rather than risking skin cancer, it's beneficial to eat vitamin D fortified foods like milk, orange juice, or breakfast cereal, or foods that are naturally high in vitamin D, like fatty fish, egg yolks, and mushrooms. Keep in mind that while these foods contain vitamin D, they generally do not have enough vitamin D to make up for what you're not getting from the sun. Check with your primary care provider about getting your vitamin D level checked, and speak with them about proper vitamin D supplementation and dosing if you are deficient in vitamin D. All right, let's talk about magnesium. Magnesium is a mineral that helps regulate calcium and vitamin D. Magnesium assists in the activation of vitamin D, which helps regulate calcium and phosphate homeostasis in your body to influence the growth and maintenance of your bones. Eating more magnesium-rich foods has been shown to improve bone health. These foods include things like nuts, such as almonds or cashews, dark leafy green vegetables, like those that are also high in calcium, soybeans, tofu, and soy milk, potatoes with the skin, bran cereal, pumpkin seeds, black beans, or delicious avocados. Let's talk a little bit about boron. This is a nutrient many of us probably haven't heard of before. Boron is a trace mineral, and it's been found that it may help build stronger bones when it's added to the diet through food. It's essential for growth and maintenance of the bone by aiding magnesium absorption and possibly helping increase how long vitamin D works in your body. Lucky for us, boron is found in a wide variety of plant-based foods, including prune juice, avocados, raisins, peaches, grape juice, apples, pears, peanuts and peanut butter, and legumes. Do not take supplements of boron without speaking to your healthcare team, but feel free to include these boron-rich foods in your diet. Thank you for taking part in today's Nutrition Basics. I hope you learned something new. As we talked about the many foods you can include in your diet to boost your bone health, consider visiting us at the farm stand for patients every Wednesday at the Adult Outpatient Pavilion from 10 a.m. to 12 p.m. until December 6th. To increase your weight-bearing exercise activities, join us at the Ramble Walking for Wellness every first and third Saturday of the month. During the Ramble, you'll get the opportunity to learn more from a VCU health provider on how to improve your health and wellness, walk and ask questions with the VCU health staff and community members, and get a good 1.5-mile walk-in. If you have any nutrition questions, please feel free to reach out to me at samantha.haswell@vcuhealth.org.